This is the scenario which I am trying to explain something which is different from old system of homeopathy, which we are calling as super specialty modern homeopathy. It's a kind of innovation and research based system, and pre and post reports of the patient's data, which we had already taken from almost 3,000 of the patients from all over the diseases like cancer, kidney failure, comatose patient, hospitalized patient, surgical category patient, autoimmune category patients, life-threatening patient, lifetime depending medication disorders type of diseases like diabetes, thyroid, hypertension, like epilepsy, migraine, allergy, like that. So we are working on same. I am trying to explain with these slides. Please try to consider this all the details. It's kind of introduction. I am actually founder of Aarogya Super Speciality Modern Homeopathy Clinic, which is located in central part of the India. It's Indore, which is in Madhya Pradesh. I am also Vice President of India for HOMI. It's a Homeopathic Medical Association of India for Indore branch, and also working as a homeopathic representative for the BRICS countries. It's an official representation for BRICS countries for homeopathy, which has been given task to me as a official appointment. This is my doctor's team. It's my doctor's team of Aarogya Super Speciality Modern Homeopathy Clinic, because everywhere it's a teamwork which we are going to give something different, and we are providing almost 19 countries online consultation with the help of our doctor's team. So this is something availability which I am supposed to be in Indore, innovation which is my field for the future of homeopathy. I am having expert team and personalized assistant, which is also requiring for each and every patient. These key values for the any healthcare industry, that we should be in global reach. As I mentioned, we are already delivering to 19 countries services by online consultation, expert leadership, me and my team, advanced homeopathy, which I will give and will explain later on. Proven success. As I mentioned, over 3,000 complex cases successfully treated, supported by clinical data and patient testimonial. This is something different which we are looking to submit to WHO, every medical council, everywhere, which is something miracle. It's having scientific approach, because science is always need to be in scientifically proven basis. So every patient's data, pre and post treatment reports will testify and justify about the progress and prognosis of the disease and their conditions, and what is something different which has been given by Super Specialty Modern Homeopathy, which we are going to explain. A strong medical team, it's already under process for recognition, and definitely for trust, as patients are trusting on us. Same thing for trust from all of you. By also honored by India's Vice President, Mr. Janjeer sir, Mr. And Health Minister of the India. Vision for the future. This is my vision, committed to presenting clinical success data to the WHO to shape homeopathy's new identity on the global stage. This is some myths about the homeopathy. In some countries, it's been mentioned that homeopathy is having placebo effect only. It's not scientific. It's most of the countries, like even in UK, Germany, homeopathy is having lots of opposition. Lots of funding has been stopped. Just given example, it's a lack of evidence. But what I am trying to say, if I am giving such example from the system of homeopathy, definitely this should be also responsibility of the local physician of the particular countries where homeopathy has been in trouble, where has been banned, or where homeopathy has been banned for some funding. So this is kind of example by successfully data, scientific evolving of the data-driven success, and global trust and accessibility. First of all, as I am working as critical and surgical disease specialist, we will start with cancer. I will represent one single case of cancer. This is something miracle also. Dr. Parvez is also here. Definitely, this is for all of you. This patient is Mrs. Arshia Ansari. She is based from Indore and she was having diagnosed with GBM, glioblastoma. It's aggressive brain tumor cancer. Almost twice surgery has been performed for her. After twice surgery, after two major operations of the brain tumor, again she developed third time recurrence of the tumors. You can see the first report. It's a 5.1 into 3.0 into 5.5 centimeter. It means almost 5.5 centimeter of the first tumor, and second tumor is 20 into 15 into 25 mm. Means almost 2.5 centimeter of the second tumor, and third one is also 20, 15 and 17. This is kind of three tumors which she was having as of recurrence of the brain tumor, which is form of aggressive tumor of cancer. In such scenario, when medical science has no scope, she has been told that there is no scope for any survival. No, even we cannot do repeat surgery because already she must have in past days twice surgery. So it is not possible for third surgery at all. Chemoradiation was not okay for her. Then she was totally hopeless condition. At the same stage, when she contacted us, definitely we given super specialty modern homeopathy treatment to her. And after 1 month of the reports, we had given some next component of the super specialty modern homeopathy with some aggression phases, and after this 6 months which we are covering this report, you can see the size of the tumor is almost 17 into 16 mm, which is only a residual tumor, apart from the which was 5.3, 3.0 and 5.5 centimeter. So definitely 5.5 centimeter of the tumor size get regressed to the 17 into 16 mm. This is kind of 80% regression of the tumor without any surgery, without any chemo, without any radiation, without any chemotherapy, and without any target therapy. This was something miracle. And the second part of the miracle was that the rest of the two tumors, which was little bit small, it was having size of 20 into 15 into 25, they got completely dissolved by super specialty modern homeopathy. Wow. So this is kind of cases. And after 4 years, as you may see, this is the report of 2019. We are talking in 2025. Still sees after 6 years, this patient is still surviving with the hope of the super specialty modern homeopathy and with the miracle of the super specialty modern homeopathy at the Indore itself. This is the kind of miracle case, because we must heard Dr. Parvez is here. As we got to know, GBM cancer is almost deadly cancer. Almost 2 to 3 years of the prognosis age is there, and after 3 years of the prognosis of the critical condition, still after 6 years, the patient is surviving and living healthy life with the help of super specialty modern homeopathy. These are there are lots of cases for the cancer patient, like acute myeloid leukemia. This is the patient. Only in 7 days, patient got benefited from the super specialty modern homeopathy, and he is surviving as of now. This is the something miracle. This patient, ovarian cancer, she was having tumor of 9 centimeter in her ovarian region. Female organ, it's 9 centimeter. Without chemotherapy, without radiation, and without surgery, we dissolved this particular tumor with the help of super specialty modern homeopathy, and still she is surviving with many hope, and there is no recurrence at all. She is surviving at Mandsaur, which is nearby to Indore. It's a local place. Same like you can see lot of patients even 80 in the age of 84 years when there is no hope for any kind of surgery, any kind of chemo. Munni Bai, she was patient of periampullary carcinoma. She got relief and 2.5 centimeter of the size of the tumor of the periampullary carcinoma, which is nearby to gallbladder, got dissolved and she got survived. For kidney failures, next topic we will cover. Kidney is very important part for our life. Like you see, when patient is suffering from kidney failure, this is the patient who was having reports of 10.34 of the creatinine. Creatinine value got increased. It was 10.34 and after only 9 days of the treatment of the super specialty modern homeopathy, the patient got reports of 1.30, which is quite normal, and he had already survived and saved from the dialysis and the renal transplant. As you may see lots of patients of the kidney failure where we had worked and up to 21 of the creatinine. This was the only case, but as I mentioned, if you will go to my website, my YouTube channel, you will see almost 3,000 of the patient with the pre and post treatment reports, and almost 21 creatinine level has been regressed by the super specialty modern homeopathy without any dialysis and without any transplant. So this is something miracle. Like in Hindi में जैसा हम कहते हैं अपनी किडनी अपनी होती है, अपनी किडनी अपनी होती है, तो अगर ईश्वर ने अगर आपको कोई अपनी चीज दी है तो उसको बचाने के लिए आपको अपना बेस्ट मेहनत करना चाहिए, और अगर डॉक्टर और आप मिलकर अगर अपनी किडनी या अपनी चीजों को बचा पाते हैं तो निश्चित रूप से ये आपके लिए किसी दूसरे जीवन से कम नहीं होता है। तो निश्चित रूप से अपनी चीजें अपनी होती है, उसको बचाना चाहिए इसी तरीके से। For autoimmune category, like everybody knows that for rheumatology patient, there is theory that RA factor, ANA factor, and HLA-B27. These are the some markers which cannot be reversed. This is something different. That's why we are giving some data for patient benefits. Like aplastic anemia, where patient is supposed to take blood transfusion for betterment of the humanity. It's a kind of coronary artery disease patient, CAD, heart patient. The patient was having ejection fraction of only 15%. When heart pumping capacity gets down, definitely patient got trouble and he cannot work in his own proper efficacy. This patient, and I would like to inform some cases about the surgical category cases. Like the patient of meningioma. Meningioma is kind of also brain tumor. Definitely, patient has to go for brain surgery. Other medication, patient is successfully dealt with modern homeopathy super specialty concept, and her tumor size of the 3.5 centimeter has been totally regressed and dissolved by the super specialty modern homeopathy. This was the miracle case because she didn't go under any kind of surgery and still she is having normal report. This is the something different, which I am also saying. After 3 years and 4 years of the after the treatment, when he used to take the recurrence, repeat reports. So definitely, repeat report is still in our favor. So this is something different. तो हमें स्वस्थ शरीर दिया है, तो इसे स्वस्थ रखने का हमें सर्वश्रेष्ठ और सर्वोत्तम उपाय करना चाहिए। हमारी कोशिश में हार नहीं होना चाहिए। देने वाला ईश्वर है, हमारी कोशिश में, प्रयासों में कमी नहीं होना चाहिए। इसी उम्मीद के साथ थैंक यू।
Thank you so much, Dr. Arpit Chopra Jain, for joining with us this evening. Getting the Oxford International Leadership.